Hello everyone, I welcome you all on my channel. So today topic of discussion will be contraception. In the last video of the contraception we did copper T and combined oral contraceptive. So today we will be covering all the rest topic here in this video. Out of all this topic, emergency contraception is the most important. So we are taking it as a first topic of today's. Okay. So the pattern will be same as we discussed in the last video. We will be covering the five previous year questions. Okay, 5 previous year questions will be covered along with the explanation of those. Okay, so let's start it without a further delay. Okay, now first question is not used as emergency contraception. So there are 4 options. So first let's study the concept of the emergency contraception. Then we will study that what are the 6 measures of emergency contraception, so that we are able to solve all this question. Okay, so first of all, you should know that there are 3 type of drugs which helps the woman who don't want to conceive. Okay, so there are 3 types of drugs. Those 3 types are contraception, emergency contraception, and abortion. Okay, so these are the 3 type of drugs. So to understand their mechanism of action and their time of action, they all are different. So understand it, first get thorough with the concept of conceiving. Okay, whenever conceiving happens, coitus happens. During the coitus, sperm enters the female genital tract, and then the fertilization happens, and then the implantation happens, right? So after implantation, that fetus, that embryo grows, and then and last of 9 months the fetus delivers. Okay, so now here the lady don't want to conceive, don't want the pregnancy. So so when we are taking the drugs, that decides which type of drugs we are taking. If the couple goes before the coitus and asks for the contraception or the pregnancy avoiding drugs, then it is a contraception. Okay, when it is contraception, if the couple goes before the coitus and asks for the pregnancy preventing drugs, then it is a contraception. Okay, and if the couple goes after the coitus and before the implantation, then we have to give that couple the emergency contraception. Okay, as you all know that the process of fertilization to implantation, it happens in 6 days. Okay, so it is an emergency. We have to give that drugs which will act and prevent the pregnancy in those 6 days. This is the emergency, no other emergency is there. Okay, so what all drug we are giving, that have to act within the 6 days. Okay, as you all know that fertilization and implantation have an interval of 6 days. So we want that the implantation to be stopped. Okay, and so here in the emergency contraception, as you will see it soon, that we are giving high doses of drugs. Okay, there is no concept of low dose. We are giving high doses of drugs so that the implantation get hampered and the couple should not and couple don't conceive. Okay, and what is abortion? If implantation has occurred, then if the implantation has occurred in the uterus, then what all drugs we give, that drugs are known as abortive drugs. Okay, and that all we have studied in the abortion chapter. They are mifepristone, misoprost, all. So you will see that whenever the question of emergency contraception is asked, it means that they are asking the drug that the coitus has happened, and they are asking that the drugs which will stop the implantation. Okay, they are not asking the abortion drugs, they are asking the drugs which will stop the implantation, and we have to give high doses of drugs. Okay, because we have only 6 days left and we have to act rapid, and there is the emergency. Okay, so let's move to the next slide now. This is a question: the dose of levonorgestrel for emergency contraception is. So one thing I would like to tell you that there are only few drugs whose dosage is asked, and one of the drug is this levonorgestrel emergency contraception. Okay, as already told to you that this is going to be a high dose. The normal level of the levonorgestrel in mala D or mala N is 150 mics. Okay, is 150 mics. These days progesterone level is 150 mics in mala D and mala N, but in this emergency contraception we are having the levonorgestrel 1.5 mg. So you can say that it is almost 10 times. Okay, it is almost 10 times. So the value, it will always be in beta, it will be in mg. Okay, the value will always be in the mg. So first of all we can cancel these two options because they are in mcg. Okay, so we are only have to deal with mg. Okay, and you will soon see that the drug value is the value of the drug is dosage of the drug is 1.5 mg. Okay, so let's start now the various methods. So they are in total, there are 6 methods starting from the first method, and needless to say it is a method of choice. Because it is a method of choice, it has been freely available by the government of India, and one doesn't need the doctor prescription also to get this drug, and it is available without prescription over the counter. Okay, so the trade name of the drug is I-pill unwanted 72 or unwanted 72, I-pill or morning after pill, after intercourse pill. Okay, so these are the different names. The drug which it contains is levonorgestrel, which is a type of progesterone, okay, and which is a type of progesterone. And how it acts is that, as you know, high dose of progesterone inhibits the LH surge, and thereby it inhibits ovulation, it inhibits implantation because it makes endometrium unfavorable, it thickens the endometrium a lot. It thickens the endometrium a lot, and that is why it thickens the endometrium a lot, and it becomes unsuitable for implantation, and yes, it affects tubal motility also. So this levonorgestrel 1.5 mg is acting on all the aspects of fertilization and implantation. Okay, next is its dose is 1.5 mg single tablet. Okay, previously there used to become 2 tablets, each of 0.75 mg and 0.75 mg, and those 2 tablets were to be taken 12 hours apart. Okay, those 2 tablets were to be taken 12 hours apart. So I wanted to tell you that if it is written 0.75 mg, then the patient or the client has to take 2 tablets. Okay, and the duration is 12 hours apart. But if it is a single tablet, it is 1.5 mg. It's quite a simple calculation. 0.75 mg is 1.5 mg, so there should be no confusion at all. Examiners are expert in creating the confusions. You should be expert in clearing the confusions. Okay, and effective period is 72 hours, and one has to take that drug in 72 hours of the unprotected intercourse. Okay, next is high dose estrogen. Okay, as you know, high dose progesterone was preventing the implantation and future pregnancy. In the same way, high dose estrogen also prevents. It is almost similar methods inhibiting ovulation and making the endometrium unfavorable for an implantation, but it is not used because estrogen in high amount causes lots and lots of nausea and vomiting. But you should know only this concept, that high dose estrogen can be used as emergency contraception. Okay, UGP was a doctor who told that as we are using high dose progesterone and high dose estrogen, then why not we use the combined oral contraceptive in high dose? They can also act and when it was given to the patient who wanted emergency contraception, it was found that they acted too. Okay, so UHP, it is known as UHP regimen, and you all know this Malari and Malayan are freely available on CHCs and PHCs, and they are available with no charge. They don't charge also. So UHP told that in spite of going to the market and asking for the drug and paying for it, one can take, if they want, they can take combined oral contraceptive in overdose. And the time when the UHP suggested this method, it was somewhere in 1970s. So when he suggested this, at that time the combined oral contraceptive contains ethinyl estradiol 50 and norgestrol was in 250 mics. Okay, so he told that take 2 tablets start, and after 12 hours take 2 tablets. But now you know that the Maladi and Malayan, they are having 30 mics of estrogen, and they are having 150 mics of progesterone or levonorgestrel. So if one wants to apply the UHP method now, then the client has to take 4 tablets start, and then after a gap of 12 hours again 4 tablets. Okay, so this is a regimen if one want it now. Okay, and it has to be taken within 72 hours of the intercourse. Okay, 72 hours of the intercourse, and yeah, they are freely available. No, nothing not to say, right? The fourth measure which one can use is having the tablet mifepristone. The tablet mifepristone, its mechanism of action is anti-progestin. It is anti-progesterone. Okay, so it inhibits implantation. Its dosage is 10 to 50 mg. Okay, and it has also be taken within 72 hours of the implantation. Okay, it has to be taken within 72 hours of the implantation. It is not available in India. Okay, it is not available in India. So once in December, I'm not remembering exactly, in December 2019 FMG, it was asked that what is the doses of the mifepristone which can be used as emergency contraception. So answer was 100, 200, 400 and 600. In those times the 600 mifepristone was available in India on the chemist shop. So the answer which we took was 600, but no doubt that even 10 to 50 mg can act as emergency contraception. Okay, but we mark this 600 because 600 mifepristone is available on the chemist shop. Okay, so 600 can also act, and as per its availability we mark this 600. So but you should know this fact that even the 10 mg dose, it can act as a emergency contraception. Okay, so all these 4 measures which we discussed, they act within 72 hours. Okay, that the next 2 measures which we are going to discuss, they can act up till 5 days. Okay, they can act up till 5 days or 120 hours of the unprotected intercourse. Okay, so let's see what are those measures. Before that, let's take the question. Question is, woman post coitus 96 hours. So 96 hours, it approximates 4 days. So best contraception which we can use within this 96 hours is oral contraception, IUCD, mifepristone or progesterone only pill. So the answer to this question is IUCD, as you have studied that oral contraception, oral contraceptive pills and mifepristone, they can only be used within 72 hours. And progesterone only pill, the levonorgestrel was also being taken only. So the other 2 methods are the tablet ulipristal. What is ulipristal? It is basically a selective progesterone receptor modulator. Question has also been asked on this thing. Ulipristal acts by the mechanism. So it acts by selective progesterone receptor modulator. As it is a selective progesterone receptor modulator, it inhibits the implantation, and its dosage is 30 mg. NEET PG has asked this question, what is the dosage of ulipristal? It is 30 mg, and it can act up till 5 days of unprotected intercourse, and it is not available in India. Okay, and last but not the least method is copper T. Okay, the drug is of course copper here. It inhibits implantation. Normal mechanism of copper T to act as contraception is also inhibiting implantation, and we can use any copper T. So any dose of copper can act here, and its period is we can use it up till 5 days of unprotected intercourse, and it is freely available in India. So the answer to the question which we discussed here, a woman postcoitus 96 hours is IUCD, and answer to the question with the first question, not used as emergency contraception. So answer to this question is danazole. Danazole is not used as emergency contraception. Okay, so that completes this all the 6 drugs along with their dosage, and yes, along with their mechanism of action. You should be thorough with this. You should be thorough with this chart. Okay, the duration in which they can be used, and their mechanism of action and their dosage, these are asked again and again. I am telling you, in FMG, in NEET PG, INICT, in every exams they are asking the dosage. So this chart you should be thoroughly, you should know this chart. Okay, now let's see next question that indicates our next topic also, preferred mode of contraception in lactation. What we can give in lactation? Let's see. We have studied that we cannot give oral contraceptive pills in lactation because lactation suppress the oral contraceptive pills or combined oral contraceptive pills, they suppress lactation. So answer option D is ruled out. Let's study now the another topic, progesterone only contraceptive. Questions come less but they can come, so you should have a superficial knowledge of this topic. Let's see what is progesterone only contraception. As I already told you that only progesterone contraceptive, they don't contain estrogen, so they don't affect the lactation. And as you know that progesterone is a steroidal compound, and the female, even after the delivery, up to 6 weeks, is in a high coagulation phase, right, has a lot of clotting factors. So we don't give this progesterone compounds, progesterone contraceptive, as they affect the lipid metabolism. Okay, so up till 6 weeks even we cannot give this compound or this drug to the female. Okay, even after the delivery, even only progesterone compounds we cannot give up till 6 weeks, and they are started after 6 weeks. Question has been asked on this also. The main side effect of all progesterone contraceptive is irregular bleeding, that you have to keep this thing in mind. Okay, next is progesterone. You all know that endometrium is proliferated by estrogen, and it is stabilized and made secretory by progesterone. Okay, so when we are giving the progesterone from the day 1 of the cycle, then it starts stabilizing the endometrium from day 1. It don't let the endometrium to proliferate, and after prolonged use of the progesterone only contraceptives, it makes the endometrium atrophy. Okay, so if a patient if the endometrium gets atrophy, then it is quite obvious that patient will not have menorrhagia. So progesterone only contraception in long usage is the treatment of menorrhagia, and is a treatment of menorrhagia. Okay, and due to this thing, they also prevent endometrial proliferation and protect the female from endometrial cancer. Okay, because endometrium is not proliferating, and hyperplasia is will not occur in a patient who is taking progesterone. So no doubt endometrium will undergo atrophy. Okay, so progesterone only pill or mini pill. Okay, old progesterone only pill, or what we say to the mini pill, that pill which contain levonorgestrone. So okay, it acts only on cervix. It used to act, the old progesterone pill, which was also known as mini pill, it acted only on cervix, and it thickened the mucus only. Okay, and by thickening the mucus, it inhibits the sperm entry into the female genital tract. But now the newer pills, progesterone only pills, desogestrel, which come by the trade name Cerazette. Okay, it also inhibits the ovulation also, and in addition to thickening the cervical mucus, it also inhibits the ovulation. Okay, but compliance of the clients toward the progesterone only pill has been always poor. Clients don't want to take progesterone only pills because the main drawback of this progesterone only pills is that they can not even delay for 1 hour. Okay, for example, I am taking the progesterone only pill. I have taken this today 8 o'clock in the morning. So tomorrow also I have to take 8 o'clock in the morning. If I did it 9 o'clock in the morning, the contraception action will fail. This time boundage thing is not compliant with the mother who has given birth to a young one, because the mother with the young one is very busy mother. So that is why the clients, they don't want to take this progesterone only pill, in spite of the fact that progesterone only pill don't hamper lactation. Okay, so now when it was came to the when scientists came to know this thing, that progesterone only pill is not being taken because every day one has to remember the time to take the pill, so they make the sustained release systems, devices for the progesterone only. Okay, so let's see what are the progesterone only sustained release devices. Let's see, these are 3 devices. Injection DAMPA. Okay, what is injection DAMPA? It is injection depot medroxy progesterone acetate. Okay, so this is injection which we give IM. Okay, and all of these, other than because they bypass the oral metabolism, so they don't affect the lipid and fat metabolism, and they can be given before 6 weeks also. Okay, so all these progesterone containing compounds, they have these subcutaneous and this subdermal and intrauterine device, they don't affect, they bypass the lipid and fat metabolism, so they don't affect them also. Okay, so they can be given in the heart patients also. And you should know that injection DAMPA, it has a property that it cures epilepsy and sickle cell anemia both up to some extent. Okay, and it's one injection of DAMPA is around 150 mg and it acts for 3 months. Okay, and imiplanon is the implant which is given in the left arm here, which is given in the left arm, in the arm here, subdermal it is implanted, and it is for 3 years. Injection DAMPA was for 3 months and imiplanon is for 3 years. It is inserted in the left arm and it is basically a one rod, you can say a small riffle type thing. It is injected subdermally, and it has the progesterone desogestrel. Okay, DAMPA progesterone is medroxyprogesterone acetate, imiplanon progesterone is desogestrel, and third sustained release device is intrauterine device of Mirena. Okay, and it contains the progesterone levonorgestrel, and it acts for 5 years. Now let's see the doses of Mirena once they have been asked in the previous year question. So we should know the dose of progesterone released per day. So progesterone in Mirena, as now you all know, is levonorgestrel. So it contain in total for 5 years, it contain 52 mg. Okay, and it releases per day 20 mics. As you all know that the oral progesterone tablet, oral Malady, it contains 150 mics. So obviously mg options are ruled out. Okay, let me show you. So this mg and mg options are ruled out. So as it is sustained release, it will be some less than the value of its daily release will be less than 150 the mics. So it is daily 20 mics, and the total levonorgestrel for the 5 years in the Mirena is, for the 5 year in the Mirena is, yes, it is around it is around 52 mg. So this is a picture of copper T. It has a copper wire around a plastic T, and this is the Mirena. It has a around a T, 52 mg levonorgestrel sustained release method is tied to it. Okay, now if you on the copper, if you see a copper wire, then it is a copper T. If on the T you see a something drug like compound bound to the vertical arm of the T, then it is a Mirena. Okay, okay. So here we have completed the second topic. Let's go to the third topic. So this question has been asked in NEET PG20. The instrument is used in. So with the typical shape of this instrument, you can come to know that this is laparoscopy instrument, and either it will be laparoscopic sterilization or either it will be laparoscopic cystectomy. Okay, all this type of structures are the laparoscopic instrument. Okay, so let's see which is used. This is used in tubectomy. Okay, so permanent sterilization methods, they are two: tubectomy and vasectomy. Vasectomy is cutting the vas deferens of the male. Okay, and the latest technique is non-scalpel vasectomy. What happens in non-scalpel vasectomy? We are not using scalpel, we are not using blade, and we are giving a very small incision with the blade or pinpoint blade. We are not using scalpel. Okay, so that is why it is known as, in Hindi it is known as chira rahit. Chira is incision and rahit means no incision. Okay, a non-scalpel vasectomy, and we give a small incision, we take out the vas deferens, and then we cut it. Okay, so main disadvantage of any vasectomy, whether it is conventional vasectomy or the latest vasectomy, even of the non-scalpel vasectomy, disadvantage is that all the male genital tubings distal to the blockage, they have sperms in it. Okay, for example, I have the portion in which I have ligated, the rest of the vas deferens will have sperms, and that takes 3 months to empty. Okay, that takes 3 months to empty. So the male is not sterilized even after vasectomy till 3 months. So it took 3 months. The confirmatory method to know that now this male is sterilized or not is to check the semen analysis. So they say that at 20 ejaculations or 3 months, whichever is later. Okay, okay. So and confirmatory method is to go for semen analysis. Now in the similar way, as we are cutting the vas deferens, we can also cut the fallopian tube, and when we cut the fallopian tube of the female, it is known as tubectomy. Okay, it involves blocking a small part of the and usually the isthmus. Needless to say, you all must be knowing that we usually incise and give the incision at the isthmus because the chances of recanalization are maximum there. Okay, though we know that even after recanalization it's a doubt whether it will function or not, but still we should know that the chances of recanalization are maximum. No one knows if any tragedy happens to that couple and they change their plan and they want to conceive, then recanalization can be one of the hope, but it's not guaranteed that recanalization will function or not. So there are two methods to approach the fallopian tube of the female. One is the laparotomy, The laparotomy method is also known as mini lap, because we have to take out only a tube. We give only 2 centimeter to 4 centimeter incision. So don't confuse mini lap with that it is laparoscopy. No, mini lap means mini means small incision, lap means laparotomy. Okay, so it is mini lap means laparotomy, small incision laparotomy, and another method to approach the tube is of course laparoscopically. Okay, so you should know that we, even after the delivery, we can do tubectomy. As you know that typical Indian females never come back. Once after the delivery, the female has gone to their home, they never come back for this tubectomy procedures, right? Nor their husbands take them to the hospital, nor they come. And neither their husband take them to the hospital, nor they come. So by mini lap, we can do this procedure even postpartum up till 7 days. Why up till 7 days we can do? Because up till 7 days the uterus is a pelvic organ and we can easily identify fallopian tube. After 7 days the uterus go inside the, uterus is a abdominal organ. Okay, here the uterus is the abdominal organ, and after the 7 days it goes inside the pelvis, and we cannot do it after 7 days. Okay, and we cannot do it, the postpartum tubectomy after 7 days, and even in the first 7 days we cannot do it by a laparoscopy. Okay, we have to do it only and only by mini laparotomy or mini lap, laparoscopically postpartum tubectomies are contraindicated. We can only do after 6 weeks of delivery, laparoscopic methods. Okay, most common technique are the modified Pomeroy technique. Okay, so this is a modified Pomeroy technique. As you can see, we lift the tube with Babcock's forceps because it gives very less injury. So it is like this forceps, and then we ligate it, and then we cut the end we have ligated. Here we cut, and then we leave it. So this is modified Pomeroy technique. Okay, so we by mini laparotomy, this is mini lap. This is the most favorable technique, and this has a very less failure rate and increased chances of recanalization. Okay, so it's the ideal technique to be performed. Now let's see non-scalpel vasectomy. False is hematoma in 5%. Yes, it's correct. Sexual function rarely affected. Yes, it's correct. Sterility immediately. No. Again, I told you the main disadvantage of the vasectomy is that the male attains sterility after 3 months. So once the question was asked in, I think, FMG August 20, that during that period what should one use? What should one use? One should use condom or one should go for abstinence for 3 months. So advising someone to go for abstinence is very impractical advice. So there you are going to mark, they are going to tick the option use condom for 3 months. Okay, so now then let's take the next topic. Now I think you must be knowing the laparoscopic procedure also. See, this is the laparoscopy, the instrument by which we do laparoscopic tubectomy. It has a pons. This holds the fallopian tube in it. Okay, it holds a fallopian tube in it, and then from behind the pressure comes, and these rings, can you appreciate this rings, white color? They go onto the fallopian tube, and the tube gets ligated. So this is the laparoscopic method, and this is the mini lap modified Pomeroy technique. Okay, now let's go to the next topic, natural method. What is natural method? In natural method, we are not using any of the drug. we are just using our basic knowledge. Okay, we all know that in a normal regular cycle of 28 days, ova gets ready to conceive at 14th day. So what we do is that for 7 days prior to getting ova ready and 7 days after the ova gets ready, we advise the couple not to conceive, not to do intercourse. Okay, so in a 28 days cycle, the couple is not is undergoing abstinence for 14 days. Okay, so the safe period when the couple can do intercourse and don't conceive is first 7 days and last 7 days. The in between 14 days 2 weeks are unsafe. Okay, so these are all, this method is also known as billing method, rhythm method, or behavioral method. The question can come with different names. Please always focus on different names. Okay, the now a woman, even a illiterate woman, can acknowledge its ovulation by two factors. You all know that the when ovulation is there, just before that estrogen is at peaks, and estrogen makes the cervical mucus thin and stretchable. So due to that factor, the female who is just to undergo ovulation feels the thin cervical or wetness, feel the wetness in the vagina, and the woman can acknowledge that soon she is going to ovulate. Okay, the progesterone is a thermogenic hormone. As the woman ovulates, and if that woman is recording its temperature daily, soon after the ovulation there is increase in the temperature by half degree Fahrenheit. Okay. So now this is a question. Many of you say that question was never comes on barrier contraceptive. See, it has come in FMG June 2022. What does this contain? This is tread 2 days, and it is a vaginal sponge which the female uses as a barrier contraceptive, and it contains a spermicidal compound nonoxynol 9. Okay, so the answer to this is option B, nonoxynol 9. Okay, now let's see what about the barrier method. Third, other barrier methods. So the barrier method which a male can use is condom, male condom. Similar way, there is also a female condom. It comes by the trade name Femidom. Okay, the other female barriers are which the female can use are diaphragm, cervical caps, vaginal sponge, which we have already seen. And the drawback of this vaginal sponge, cervical caps and diaphragm, if the woman forgets to remove it after the intercourse, then they can if it is left for more than 24 hours, then they can cause septic shock syndrome. Okay, and they have high failure rate. And why their failure rate is so high? Because they are less efficient as compared to the other hormonal methods, and moreover no one is following their proper usage. So due to the improper usage and their lesser efficiency, they are having the high failure rate. So they all usually all of these barrier methods, they are coated by a spermicidal xylene nonoxynol 9. Okay, let's move to the next slide. So these are the pictures of different barrier contraceptive. This is the vaginal sponge which comes by the trade name Today. These are male condom, and this is the female condom. As you know that female vagina is much large as compared to the penis. So in the similar way, female condom is also very large. This is a cap which has a hat like structure, and this is semicircular in shape. This is the diaphragm, and this is a spermicidal jelly. Okay, in a similar way, these are also contraceptives, but they are not barrier vaginal ring and patches. They contain estrogen and progesterone both, so they are hormonal contraceptive, combined oral contraceptive, not pills, combined oral contraceptives. Okay, they are not barriers. So let's see. This is Pearl Index. So this is a question of FMG June 2018. What is Pearl Index? So even after the uses of contraception, the contraception can fail. So what is which contraception fails how much? Even after the usage of contraception, the accidental pregnancy noted is the Pearl Index. So the answer to this option is A. Let's go to the next question. This question has not come in any exam, but it is expected question. We always expect in each and every exam. Okay, Pearl Index is lowest in. So it is as you know that vasectomy and tubectomy are surgical procedures. Still the imiplant or the imiplanon progesterone only implant, and it has the lowest failure rate, whereas tubectomy and vasectomy has a higher failure rate as compared to imiplant. Let's see now all contraception methods failure rate. Okay, now what is Pearl Index? It indicates the failure of contraception, that is how often that contraception can fail. Okay, it is calculated as per 100 women year. In a short form it is written like this, HWY. So what is HWY? HWY means that we have used that if we use that contraception in 100 women, and all that 100 women are using it for 1 year, then how many of them will fail? So vasectomy has failure rate of 0.1 per 100 women year. Implants have 0.05. Okay, so implants have the lower failure rate, and tubectomy has high failure rate than the vasectomy. And as vasectomy is less invasive than tubectomy, so it is always said promote vasectomy due to two facts, that vasectomy is less invasive than tubectomy, moreover, and number two, vasectomy has less failure rate. Okay, Copper-T and combined oral contraceptive, the two methods which we discussed in the last video, have almost same 0.6 and 0.5. And levonorgestrel IUCD, it has similar failure rate as that of the tubectomy. They have the similar failure rate. Tubectomy and levonorgestrel IUCD, they have the similar failure rate. Okay, so now you come to know that in spite that the tubectomy and vasectomy, they are surgical method, still implanon is having less failure rate. Okay, and progesterone only pill has failure rate of 1 to 2 because no one takes them properly. थोड़ा बहुत इधर उधर हो ही जाती है. Barrier method, if idly we use it, it has 2, and because no one is using them idly in a proper instructions, so their failure rate is 20 per 100 women year. And natural method, they have a failure rate of 25. Last but not the least, these days they are asking the question on LARC. What is LARC? Let me tell you. Long acting reversible contraceptive. Long acting reversible contraception. ठीक है. So but how much long, किसी को to say a contraception measure is long acting, what is the duration? So Williams says that if we are taking a contraception once in a month, it comes in a category of long acting reversible contraception. Okay, so in long acting, and it should be reversible. Okay, so in long acting reversible contraception comes Copper-T, levonorgestrel, implants, injection dumpa. Injection dumpa was, as we already have studied, it was for 3 months. So it is much more than 1 month, so it also comes in it. Question had come in AIMS on this. So let's take the question. It has come in AIMS. All are LARC except Copper-T, imiplanon, injection dumpa, and lap tubal ligation. So answer to this question is lap tubal ligation. So we all know that tubal ligation can be recanalized, but as the success rate is very less, they are not LARC. Okay, they are not reversible. Okay, They are permanent method of sterilization. That's all in the that all in this that was all in this contraception part 2 video. Contraception is completed. See you soon in the next video. To practice more and more question, do subscribe my Telegram channel at the rate 8. Let me write down at the rate doc dr Rana OBG. Okay. Thank you.